Dr. James Justice. I'm a certified natural medical practitioner based in London, the UK. Besides that, I'm a gerontologist, especially for the aging. That also specialize in the chronic diseases like diabetes, heart problems, cancers, and the gastric problems. I'm also a nutritionist. So, well, this is what just for you to know who you're listening to. So today we're talking about atrial fibrillation. That's what we want to talk about today. As the Bible says that my people perish because of what? Lack of knowledge. We are empowering ourselves through knowledge. I just want to encourage you just in a minute here. You know what? If you look into the Bible, you see that Jacob and Esau. We realize that Esau sold his birthright to Jacob because he was so hungry that, of course, he said, well, what am I to do if tomorrow I would die if I don't really eat? This is what we know the story. I don't want to go into details, just a few seconds here. I want us to learn something from it. Esau just based his decision on his feelings. And I just want to encourage you all, don't actually make any permanent decision based on your temporary feelings. Today, because of the chaos we're facing, because of the situation, people actually are making decisions. They are afraid. Of course, everyone is afraid to die. But then if you're not careful, you could make some decisions that can really, through that, sell your birthright. But it's not about birthright per se. Your birthright here can symbolize your good health. That good health that God has given you, you can sell it out by being hasty, by just being basing your decision on your emotions. So it's really very important for us to be very super selective and not just to be in haste, to make decisions. But we should be careful based on the knowledge that we have to be able to make the right decision for good health in the future. That good health is already in you. That's why we are empowering ourselves today through knowledge to make the right decision in the future, not to be in a haste. Right. But now let's come to our topic today. The topic is atrial fibrillation. Sometimes we call it AFib or AF. Now, atrial fibrillation, what is it at all? Today we will get to know what is really atrial fibrillation. We will get to know the symptoms. We will also know about the risk factors and the complications of atrial fibrillation. When we talk about atrial fibrillation, it's something that naturally is about our heart. It's about how the heart beats. The heart is not beating well as it should be beating. So the heart is in disharmony. The beat is not in harmony. When we talk about beat, the rhythm is a harmonious system or mechanism. But in atrial fibrillation, this rhythm is not in harmony. And so that is why it causes what people can describe as palpitation, that you will see that your heart will be beating hard in your chest. There was a patient that came forward that had this experience of atrial fibrillation. But before I come to this patient's story, but let me just simply let you understand what is really atrial fibrillation. Atrial fibrillation is the most common type of heart arrhythmia. That is irregular heartbeat that can interrupt the normal flow of blood. So you know what? If your heart doesn't actually beat well, you will not have the full capacity of blood flowing in you. Definitely, there will be an enormous or huge reduction of blood flow in you. That's the capacity. That's what we call that the weak circulation. You will definitely have weak circulation. And how would you know that your blood flow in you has reduced? Normally, what you recognize firstly is the tingling and numbness in your fingers and then your feet, and then of course dizziness and fainting. Because now if you have reduced capacity of blood flowing in the body because of atrial fibrillation, or the heart is not beating as it should be, or there is a disharmony in that the chambers of the heart, then of course you know that it's about atrial fibrillation. We've got to know it very, very soon about atrial fibrillation. A patient described his condition. He said, "Doctor, when I was climbing steps, I felt like a flip-flop, or my heart was skipping. The beat was skipping. It was like my heart was banging in my chest wall. And especially when I was going uphill or climbing steps, when I was just carrying something." So there was a sort of a banging of the heart in the person's chest. And the person felt kind of nauseated, felt like vomiting when the heart was banging in his chest. So that is a very typical condition of atrial fibrillation. There was a kind of there's a disharmony of the rhythm of the heart. Now, before you understand this topic, give me a few seconds to explain to you how this heart works in the human body and the structure of the heart. Just a few seconds. Just understanding of the heart, how the heart works. Just a few seconds here. In a human heart, the human works like a pump, sending blood around the body to keep you alive, carrying oxygen, all right, and nutrients from the food that you've digested to your organs, to your cells, and to carry carbon dioxide and waste and back, of course, to run out of your body through what? Through defecate, of course, and through the urine. So the blood circulation is very important. But we all even know that blood is what? The life of the flesh. So it means that we need blood everywhere in the body, in the right amount. So in atrial fibrillation, you don't have that amount of blood flowing in you. It reduces. Now, the heart, it beats about 100 times a day, 100 times in 24 hours, and pumps continuously about 5 liters of blood around the body. About 5 liters. So if you don't get that 5 liters of blood running through your body, and it's reduced to about 4 liters or 4.5 liters, you will have problem. So there should be enough of that volume of blood should flow. But before you can be guaranteed of that blood flow, your heart should be beating perfectly well. But if you have atrial fibrillation, then you can have that kind of benefit at all. Now, what happens actually in atrial fibrillation? Normally, your heart contracts and relaxes to a regular beat. You see, when you fist up and you release the fist, that's how the heart actually works. You fist up and you release it, you relax it. You fist up and you relax. That's how it's a pump, right? It's a pump. When you fist up, the size of your fist is exactly the size of your heart. And the women's heart, it normally is quite smaller, a bit smaller than men's heart. And so that's why it's one of the reasons why heart diseases can be hidden in women, because it's really different heart structure, different size of heart. And then, of course, heartbeat as well. Women's heart beat a bit faster than men's heart. But let's move on to what really happens in atrial fibrillation. You see, the heart got 2 chambers, right? 2 chambers, the upper chambers and the lower chambers. In atrial fibrillation, the upper chambers are supposed to beat in unison with the lower chambers. But what happens in atrial fibrillation is this. The upper chambers quivers. It doesn't really beat as it should beat. It rather shakes. It's rather just, it doesn't really move. It quivers. And when it quivers, it kind of is not in harmony with the lower chamber. And so that what causes blood pool in the heart. And when there's a blood pool in the heart, what happens? It's a risk of clot formation. It forms clot in your heart. And if you don't have free arteries, that's the blood vessels which supply blood to your brain and other organs up to your feet, normally if there is a plugging in your arteries, the artery which supplies blood to your brain is called a carotid artery. And if these arteries are plugged or narrowed, then if there's a blood pool in your heart as a result of atrial fibrillation, then this clot will swim into that narrow area and block it or plug it completely. So blood will not get into your brain. And if blood doesn't get into your brain in few seconds, that person experiences what we call stroke. So that's how stroke happens typically. Typically, it happens. Of course, we have other forms of stroke. That is the internal bleeding. That is the through aneurysm. But that is not too common at all. That is internal bleeding in the brain. It's not common at all. But what is common is the plugging of the arteries and then the clotting. That through atrial fibrillation, that can cause clots or what I call the blood pool in your heart and leads to clotting of the blood, which can lead to this stroke. Is the most common form of occurrence of stroke. And so people that got diabetes, they have plugging of the arteries. Diabetic patients, you cannot run away from it at all, because that is one of the complications of diabetic condition, plugging your arteries. So atrial fibrillation, by research or through research, we've got to know that if it is the five-fold or 5 times increased risk of stroke if somebody has AFib or atrial fibrillation, what we're talking about now. So it's something that you can't underestimate it. You can't look down upon it at all. You got to really find the root cause of your problem. If it's the structural changes of the heart, which is normally the cause of that, we got to remodel your heart again by strengthening the heart muscles to get the shape of the heart back, to really the heart to beat or pump well, to be efficient once again. But let's talk about the symptoms of atrial fibrillation. How would you know that you have atrial fibrillation or AFib? But before I talk about the symptoms, listeners, let me put the number on the platform. So if somebody wants to call me, maybe to discuss something about atrial fibrillation or any other disease, you can contact me. Calling from outside the UK is a +44 738 464 7300. This number again, +44 738 464 7300. Now, second number is +44 745 988 9152. The number again, +44 745 988 9152. If you have it, these numbers are also WhatsApp. You can call me, and one-on-one we can talk in details. Now let's have a look now at the symptoms of AFib or atrial fibrillation, which can not normally lead to stroke. Now the first symptom is the shake, that quivering of or the fluttering of heartbeat, or thumping in your chest. You can feel it, that your heart is beating hard in your chest. You know, normally God has created in the way that when the heart beats, you shouldn't feel it. No one should feel your heart beating. It's abnormal for you to feel your heart is beating. If you feel your heart beating, then something is wrong with your heart. So in atrial fibrillation, you will feel that quivering or fluttering of the heartbeat. And so this is the typical symptom. The next symptom is general fatigue because of the decreased in the blood circulation, or the capacity of blood, which carries, of course, oxygen to give you the energy. You don't have energy all the time. So there's a general fatigue all the time, even after 8 hours sleep in the night. So it's also typical. But we also look at that you will experience from time to time that palpitation or that irregular heartbeat or rapid. Your heart will beat very quickly in your chest, and then it becomes normal again. Don't overlook it. And then dizziness. You may experience dizziness because of reduction of blood going into your brain. You may experience dizziness, and then you may also experience you'll be short of breath, and then you'll be filled with anxiety, because if your heart is not working well, and then your brain is not receiving enough blood, definitely you'll be filled up with anxiety and panic. That panic attack that people experience is normally because of that. Circulatory problem leads to panic. Panic, that is it. So take note of that. And fainting, you feel like fainting, and confusion is also a part of it, of atrial fibrillation or AFib a symptom. Sweating is also another one. Sweating. If you are sweating in an environment that even is not too warm, and you sweat, it means that your heart is overworking, it's pounding. And when your heart is overworking, then you sweat. It's indication of that. And listeners, if you feel chest pain together with all the symptoms I have mentioned, then it is a medical emergency. You have to call for help for you to be stabilized. But after being stabilized, call me, because we have medicine to remold your heart once again. Remold it. Heart diseases is number one killer in the world. It's not COVID. COVID is not anywhere. If we put COVID together with cancer and other diseases, even it's not 50% of heart-related deaths. Now, when we move on, if these symptoms persist, then of course, as I said, is a matter of emergency. When you are even sitting or standing and you experience any of these symptoms, then it's a matter of emergency, especially pain in the heart. Let's come to the causes here. The causes, we say, what causes atrial fibrillation? Is the damage to your heart structure. The heart is a muscle. So if we say there's a damage to the heart, it means that your muscles, instead of your muscles to be long, they have become short. Sorry, instead of it to be short, they have become long. Long muscles cannot pump well. Short muscles is like 100 meters runner. 100 meters runners got very short muscle. They're very strong. They can run very quickly in that 100 meters. So the heart is like that. The heart muscles should be short, strong to pump well. So when the heart is damaged, we say that there is abnormalities of the heart. The heart muscle become long and it loses the pumping ability. That is it here. But what brings about this weakness of heart? Blood pressure. Blood pressure is a number one problem, and diabetes is also, I will put it the same level, number one problem. People have blood pressure, which is actually not a disease. It is a symptom of underlying problem. Something brought it up, as I told you when I was treating blood pressure the last 3 weeks. It could be the kidneys, it could be the arteries, it could be the heart, it could be the brain, it could be your thyroid. That could be the reason why you have blood pressure. So you have to trace it and find out what is causing your blood pressure. But high blood pressure, about 180 or 200 over 120, definitely will cause changes to your heart and also changes to your kidneys. Definitely, that's a damage to your kidneys. When we move on, when somebody has diabetes, it causes definitely plugging of the arteries. Your arteries become plugged, it becomes narrowed, and when the person has atrial fibrillation, there is a tendency for clot, and it can lead to stroke. Heart attack is another cause. If anybody has ever had a heart attack before, then of course there's a tendency that the person will have, or that the risk factor that the person will definitely experience atrial fibrillation. And then we have what they call the coronary artery disease. A coronary artery disease is the main artery supplying blood to directly to the heart. And if that artery is plugged, we call that atherosclerosis. If it is plugged, it can then also lead to malfunction of the heart. The heart structure can be also be abnormal, and it can lead to atrial fibrillation as well. And then we also call abnormal heart valves. Abnormal heart valves, these are we call the gates inside your heart, which normally should direct the blood flow in one direction to prevent backflow of the heart, which can cause what they call blood pool in your heart. If there's a blood pool in your heart, clots can form. So if there is a heart valve problem or abnormal heart valve in your heart, it can also lead to this problem. In fact, it's a real concern. There may be people that may be born with, but it's not a common thing at all. It's not a common situation. But another condition is overactive thyroid. Thyroid is a gland that is under your neck. It's like butterfly shape, very small. In fact, it's a small gland, but it's powerful. It controls so many things in the body. So if you have a hyperthyroidism, if you have been diagnosed of hyperthyroidism or overactive thyroid, then beware that you stand the risk of getting atrial fibrillation as well. Those that have been exposed to stimulants like medications, coffee, tobacco, smoking, you may say, well, I don't smoke. But if you stand near a smoker, that's a secondary smoker, you also have that risk. And the alcohol is also a risk factor too. Those that enjoy Guinness and, taking alcohol regularly, it can be a real problem, a real concern. That's why we say that alcohol can damage your heart. This is the reason, lung diseases. Lung diseases is also a real problem. It can lead to atrial fibrillation. That'll say a loss of that rhythm of your heart. And then previous heart surgery. Those that have had a heart surgery before, there's also risk to experience this problem. Those that have had also viral infections. If you have viral infections, of course, often you also have the risk of getting this atrial fibrillation. That's why it's very important to have a strong immune system. If you need to build up your immune system, please just give me a call and I'll be more than happy to help you. And those that they face stress, constant stress abroad is something that can also cause direct impact on the heart. It can also lead to this problem. There's another condition. It's called sleep apnea. Sleep apnea is what? It's simply you may sleep. When you sleep at night, you may have your breath. Your breathing may cut off for a few seconds. You may not breathe for a few seconds, and it starts again. And that it could happen about 5 to 100 times before even day breaks. You wouldn't recognize it. Sleep apnea. That is the break in your breathing. When your breathing breaks, like 5 seconds, 2 seconds break, and it starts again, it's called sleep apnea. It's a risk factor for this atrial fibrillation and also blood pressure and also stroke. Only your husband or your wife may know that you have sleep apnea. So maybe we should be telling our wives and husbands to observe us when we sleep. And we have a condition called hypertrophic cardiomyopathy. What is it? Hypertrophic cardiomyopathy. It means that your heart muscles become too thick, or it becomes stretched out, or it becomes too thin. You see, that the cardiomyopathy, that can also cause problems to the rhythm of the heart. So the risk is very clear. The risk is about age. With age, we experience atherosclerosis, it means plugging of the arteries. In the past, we didn't used to have this atherosclerosis in the 40s or even 50s. It used to be in the 70s, 80s, 90s, and then people age gracefully. But these days, because of chemicals, hormones, antibiotics in the food, and our lifestyle, stress, and lack of sleep in the night, we experience constant inflammation in the body, and then yeast and sugar in the system can corrode the artery walls, and then our body will then plug it. So the plugging of the arteries can lead to this problem. That's why we say increased age. Now, being a male, normally men have this atrial fibrillation more than women, but women also have this, but more male may have this. Family history is only 3-5%, and it's something that you shouldn't be worried. It all depends on your lifestyle. Now, the complications of atrial fibrillation, that is arrhythmia of the heart, is stroke, heart attack, heart failure. Not that your heart is failing, but it's failing to meet the needs that is of your body, not be able to pump well to supply blood within to your brain and other organs. That is heart failure. So it can also, if somebody has atrial fibrillation, within a short time, listeners, it can remold the structure of your heart in a short time. So you shouldn't joke with it at all. If you have palpitation, you shouldn't joke with it at all. If you are there, and then when you're there within a short time, you have from time to time, you have a quivering in your chest. Your heart may beat very quickly, and then it normalizes. It beats quickly and normalizes. Be very careful, because your heart structure is remodeling. So what do we take home today? What do we take home today? We have learned that atrial fibrillation is just the disharmony of the upper chambers of the heart and the lower chamber, which leads to that so-called palpitation. And we know that in a short time, atrial fibrillation can remold your heart, and that it can lead to heart failure and even sudden cardiac death. It can also lead to stroke. If you have diabetes, if you have blood pressure, it's a really huge risk factor. But the good news for you is that there's a solution to this problem. We can help you to remold back your heart to the natural shape, to avoid all these problems. Give me a call, and your life will never be the same. I thank you so much, listeners, for actually sharing with us today, your precious time with us. Keep supporting, and I will meet you on Thursday at 8 p.m. Now we've changed the time. It's 8 p.m. on Sunday and 8 p.m. on Thursday, not to create any confusion. The English section will always be at 8:30. Please share this good news for other people to know what we are doing. God richly bless you, and may He smile upon you this coming week. God bless you. Thank you very much. Bye.
The first development of diseases is in the cell's tissues before they get into the blood, urine, and stool. Diseases do not start in the blood, and so if you are waiting for investigations to be done on your blood sample to know your disease, the results will only be a confirmation of a well-developed disease. Yes, it is only being confirmed. Had I known, it's always at last. That is why we are recommending Dr. James Natural Link. Our facility is well equipped with ultra-modern smart machines to screen and identify all diseases, your well-being, and what is going to happen within 6 months to 1 year in your body. Dr. James is an experienced natural medical practitioner, gerontologist, and a health educator. He graduated from a renowned Canadian institution and practiced in Europe. We offer many natural therapy like detox, pain management, skin problems, weight loss, anti-aging, and many more. We will give advice on dieting for all medical conditions. With over 20 years of experience, Natural Link will help your body cure itself from all diseases such as blood pressure, diabetes, stroke, heart diseases, arthritis, kidney and liver disease, prostate enlargement, asthma, hair loss, and even cancer, and many other diseases. As the saying, seeing is believing. We will, with our ultra-modern smart machines, screen your body to get rid of all hidden diseases. Call us on 073 846 47300 or 074 598 89152. Address 9211 Gunnery Terrace, Woolwich, Arsenal, London. SE186SW. Email holisticforall@gmail.com. They say prevention is better than cure, but we say prevention is better than intervention. Dr. James Natural Link, purely natural, getting well naturally.